So we talked about what osmolality was again already, right? Osmolality is the percentage of particles in the water. Here they're giving you the norm. This is like useless in the real world. I don't know. Maybe not. I don't know. Maybe like physicians look at it for something, but we don't usually look at that. And then what's making that osmolality in the body, right, is usually your sodium, glucose, and urea. Those are kind of the big players. The most we have the particles that we have kind of the most of in our body. Although potassium is also very, very important. We'll talk about. When we're talking about tonicity, we're talking about concentrations of fluids that are separated by a membrane. So the difference, it's kind of like the gradient, right? The difference between what's in this compartment and what's in this compartment. This can be compared to, so here, the tonicity is much higher on this side than it is on this side, right? That's all they're doing. Tonicity is hypertonic or hypotonic. The tonicity is basically telling you, again, it's kind of representing the amount of particles inside that solution, but it's usually about, usually when we're talking about tonicity, we're talking about what's in the bag of stuff that we're giving the patient, right? It's either hypertonic or hypotonic. It's really very, very similar to osmolality because it's telling you the amount of solute compared to the amount of water. That's all you need to know. You don't need to worry about telling the difference between those two things. And then I'm not sure going with osmotic forces. What does osmolality have to do with? Right. Okay, so this is just talking about osmotic pressure. They're saying, what does osmolality and tonicity have to do with fluid balance? Well, because we know that if we have a high amount of particles, or the osmolality or tonicity is high, it's going to pull the fluid towards it, right? Because we know that that's an osmotic pressure. When we have lots of solute or whatever's built up in there, it's going to pull, right? So, and again, we talked earlier about inside the cell, we have a very, very high count of, right, potassium. And outside the cell, in the extracellular fluid, so usually let's talk about in the blood, right, we have a very, very high count of sodium. We're going to talk more about this, so don't worry about understanding it right now. Just understand, and really I'm sure you do because we've talked about it ad nauseum. And keep going.
There was some confusion when we were talking about osmolality earlier today that I wanted to just clear up. As Kieran and I said, knowing these values isn't as important. I've definitely never seen them come up in real life. I've never seen them come up on a test. It's the idea of what does it mean when osmolality is high? What does it mean when osmolality is low? If you want to memorize these numbers, you go right ahead if it makes you feel safer. But really, it's the idea of what's going on in the body. So when the osmolarity or osmolality is high, it can tell you two different things. What this slide is asking is, what does it mean in terms of fluids, right? So if we look at that little cup that we drew earlier, what does it mean? So let's say we have a nice normal osmolality. We've got an nice equal number here as we do outside, whatever. Everything's great. What happens when we lose some of that water? Let's say we have this. We don't lose the particles. The particles are still there. But now we have way more of them per liter of water. So the ratio of particle to water has gone way up. Does that mean we've gained particles? Usually not. What it tells us about fluid is that we've lost fluid. The same is true when we have low osmolality. If we have gained a bunch of fluid, then our percentage of osmoles or particles to water is going to be lower, right? Because we have so much more water than we have particles. Is it telling us that we've lost particles? Possibly, but what it's telling us about water or fluid balance is that we've gained fluid. And so this can get really, really confusing. We'll talk more about this when we talk about sodium and the sodium balance in the body. So if you're not quite getting it right here, don't worry about it. We'll talk about it again.